Hello and welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce here in the beautiful offices of UnitedHealthcare with Claudia Maya, who's Regional Vice President for UnitedHealthcare. And I'm so excited because she came all the way from El Paso.
Texas.
Yes, to do many things, but among all those many things, to be here with me on a Business Minute with Lily Lopez. Muy importante. So what a pleasure and an honor to have you here today.
Thank you.
As I was saying, we've worked with UnitedHealthcare. They've been members, supporting members for at least 20 years. So it's a nice relationship that we have. So tell me, we're in open enrollment. ¿Qué está pasando? ¿Qué está pasando, Claudia?
Yes. So there's so many different types of insurances, and I think that's the most important first point, right? So let's talk about it, the different variations. Number one is Medicaid, right? That is the type of insurance that the state gives the population based on their income, okay? And then you have folks that are retired, 65 and plus. That's Medicare, okay? And then there's commercial. Commercial is when employers like yourselves decide to offer insurance, a private insurance through a private carrier for your employees. That's commercial. And then everybody else, the ones that don't qualify for this or their employer don't give them, that's ACA. That's the division that I support. So folks know it as Marketplace,
ACA,
Obamacare. I recently heard Biden Care.
Okay.
So there's different variations, but the most important thing that I want everybody to walk out is that this is the option for everybody that doesn't have insurance, basically.
Exactly.
Okay.
How long is the period? The period.
There's open enrollment periods for the different departments that I mentioned earlier. So for ACA, which is the division I oversee, it is November 1st through January 15th. Okay. But if you want to have coverage January 15, you have to do it by the 15th of December. Okay. That's number one. Medicare, those that are 65 and over, it is this October 15th through, and I need to check, is December 7th. And then for those that are offered through employers, you typically have 2 to 3 weeks from September to December. So a lot of dates, a lot of different decisions.
And you know they're all de memoria.
Well, I practice, and I've been with United for 15 years.
For 15 years.
14. And so I've worked with the different divisions.
So you know. And what is the main message that we need to provide to everybody who's listening to this, especially with regard to, I know Obamacare that they called it before, and it's not Obamacare, but whatever, be it as it may, that's how people know it. And what's happening to that? Because I heard there was a lot of controversy that was not going to be around, that people are going to not have the opportunity to be in that plan.
So I think what's so important is for people to understand that the government shutdown, or the way that it was impacted or is currently impacted, is that there are subsidies right now available for people that get on the ACA. The subsidies come in different forms. The subsidies is to pay your premium or to help with deductibles. It all depends on the family size and the income.
Of course.
Yes. The question right now, or what government is analyzing, is that there was an expanded version for more subsidies for a certain FPL, which is a certain income level.
Right.
That is the one that's at question. Not so much that all subsidies are being done away. It's only a certain level.
Well, I'm glad you're clarifying that because it was very confusing.
So
thank you.
We did a study within our own population. Only 34% knew that something's gonna happen, but they don't know what.
But they don't know, exactly. And it was like a big thing.
Yes.
And everybody was so scared, and they would call us in the office.
Everybody's worried,
scared,
but the most important thing is understand what kind of coverage you need, right? Look at your doctors and look at your specific situation.
And your needs, right?
Everybody's different.
Everybody's
family and you as an individual.
Of course, yes, exactly. And anything else that we should
I would
address
also
and tell the members?
I would also encourage you all, you don't have to go see a doctor. You can actually tap into virtual care to visit
Tell
somebody.
me about virtual care.
Everybody's on the go. Business owners are running their businesses, but remember, if you're not healthy, it's going to be tough for you to run your business. And what's the most important, I think, message here is preventative care versus when you already feel sick.
Exactly, preventive care.
So look at options, look to see which ones offer. And then us Hispanics, unfortunately,
no nos cuidamos tanto.
no nos cuidamos tanto. And 50% of us have diabetes.
Sí, señor.
So
Yes.
plans with United
Yes,
have
diabetes.
$0 insulin and supplies for diabetes.
And the diabetes is probably because of the foods.
Maybe foods
Maybe the
are
foods
just
comemos mucho.
Yes, but
No
it's
gusta la
part of
comida
our
rica. It's part of the culture.
It's part of our culture.
I know, so we need to just eat the same foods, but less amount, I would think.
Less amount and get your treatments on time.
Exactly on time. Just what she's saying. So it's such a pleasure to have you on a Business Minute with Lily Lopez, and keep up the good work. Great. And you're
We
like
love
a
it.
walking encyclopedia. I love the way that you look at the camera and you have your facts, statistics, and it's very informative, and that's what we want. We want people like you to provide that information to all of our viewers, not only our members, but the entire viewership of the
you.
Business Minute with Lily Lopez. So thank you.
Thank
you
you.
so much,
Have a
Claudia.
great day.
Un placer, and I will see you all next week. Thank you for tuning in to another episode of A Business Minute with Lily Lopez.